Next we have the shoulder, and this is phase 1. So the first exercise is S10, active range of motion, and we'll show you some different directions here. First, we'll just have the patient do some flexion here. So thumbs kind of forward, straight up and down. Yeah, both arms there. We got some extension, so just having the patient bring their arm back. Have some abduction. Just good posture while they're doing these. Just have the patient do it to right before the point of pain. We just want to feel a slight stretch with these. That's a good warm up to do when the patient first gets to the ER office here. Next we have S11, which is the posterior shoulder stretch. This one you kind of just keep the patient, arm goes straight across the body, it's not down here, straight across, the hands behind the elbow, the arm slightly bent, and you're just going to feel a stretch right through that area right there. Hands go straight on the other side. And we'll start with 20 seconds, work our way up to 30 seconds. Start about 3 on each side, it's fine. And then we'll move into the S12, which is the internal-external rotation stretch. Here we're going to use just a regular sized towel. One hand's above, one hand's wrapped around that direction. And if the affected arm was the right arm, we're just trying to stretch external rotation. He will pull down with this hand here. You should feel a stretch there. Now on the opposite side, this was the affected to work internal rotation. He's just pulling up this arm here. Next we have the pec stretch again. So key the patient. Good posture, eyes looking forward. Right now we're going to do a high, medium, low. So right arm's a little higher. He's just stepping forward, good stretch of the pecs. 20 seconds, we'll work our way to 30 seconds. Then you key the patient to go a little lower at 90 degrees. Same thing, 20 seconds. Controlled breathing through these exercises. And then a little lower. So one high, one medium, one low, all for 20 seconds. We'll work our way to 30 seconds for those. Next we have the supine cane stretch. So this is for a person who doesn't have all their range of motion quite yet. And just keep the patient comfortable position on, if you got a broomstick, a ruler, a cane in your office. And gravity's just assisting to get a good stretch. We'll start with about 5 seconds, work our way to 10 seconds. Have the patient do about 10 of these. And knees are bent if you want to just take a little pressure off the back. Controlled breathing, sometimes you'll see the face go red, and that is the supine cane stretch. Next exercise we have S15, which is the shrug and roll back. This is done with no TheraBand or anything. You just have the patient in good posture. You shrug your shoulders, rolling back, and a good squeeze in between the shoulder blades. Controlled breathing. Just about a 2 to 3 second process, just nice and slow. Roll back and squeeze. Next we have the seated scap squeeze. So he's seated, work this one, good posture. He's just going to squeeze the shoulder blades together. 2 second squeeze and relax. Controlled breathing through this exercise. And then he's going to show another angle here. He's just squeezing. You can see, you tell a patient to act like you're squeezing an orange or something between your shoulder blades. And rolling the shoulders back also. Next exercise, we have just wall walks. This can be demonstrated on the wall, obviously. You just have the patient have the palm on the wall. You can walk or just slide. You can lean into it. Hold this stretch for 5 to 10 seconds. Kind of work your way to 10. You just slide back down to the wall. That's just going to assist with a good stretch there. We'll also demonstrate abduction. So we did flexion, so this would be abduction. Same idea. He's facing away from the wall towards the side. He's leaned into to get the further stretch there. Another way you can do this is with a ball. The same idea. Ball allows you to get a little further stretch if needed. So you're just going to use the ball there instead of the wall. Here's abduction there. So we work your way to 10 times for 10 seconds is what you'd shoot for if the patient needs to do that exercise. Next we have, this will be S18, post-surgical active assisted range of motion. Here we're going to use a broomstick. If you've got a cane in your office, that's fine as well. First we'll just do flexion. So the other arm's assisting with the stretch there. So up and down. And then we'll demonstrate external rotation. So one arm's at the end. One arm's, you're going to push with that left arm if the right arm's the affected one. Just going to hold for about, we'll shoot for 10 seconds, start at 5. You can do this standing or seated. Next, we'll lay on the table to show horizontal abduction and adduction there. So he's just using one arm or the other just to help assist with that motion. 5 to 10 seconds. Just for post-surgical active assisted range of motion. Next, which is our last of the phase 1 of the shoulder, is the pendulums. We're going to demonstrate with these doing clockwise and counterclockwise. Patient, the left arm's affected. We're just going to have them kind of use their body momentum to cause some circles. Try to get the full range of motion. We'll do 30 counterclockwise, 30 clockwise. And if the patient's just having trouble just getting momentum to do it, we just want all their muscles relaxed in the shoulder. If they're having trouble understanding that, you can place a ball, just a small physio ball, just to have them kind of use the ball to help rotate. So we're all these muscles here are relaxed. So it's just good warm up exercise before they go to bed and after they go to bed, first get to your office, or at the end of your treatment. And that concludes shoulder phase 1.